there's a peak bone density point we get to for males and females, which is a staggeringly young age. It's in
25 to
20s.
30, yeah, 25 to 30 years old is the peak there, absolutely. And thereafter, it plateaus for a while. It's different in everybody. And then 30 to 40, it begins to go down at average about 1% per year. And then for women, it accelerates. The average loss during menopause is 1.9% per year. So you have that doubling of the bone degradation during menopause. And again, that's where, when you reach that peak, if it's a bit lower than it should be, and another 10 years later, and then menopause or early menopause, and you don't really know you need to worry about your bones, and then you lose 2% a year, and that's an average. I've seen 3 or 4% a year in some patients.
Wow, massive, isn't it?
And so if you're 3 years in and it's going down 3 or 4% a year, and you were already low for whatever reason, whether it is sort of eating, disorders younger, vitamin D deficiency, not doing sort of sport or having injuries even when you're younger, all of those things reduce that peak bone density. All of a sudden you're 2 or 3 years into menopause and there's a problem. Unfortunately, it's a silent problem because unless you have a scan, you won't know about it. There aren't symptoms at that age until you have a fracture. And therein lies the problem.